Well, Kelly Clark is the Marketing and Communication Specialist with Titusville Area Hospital. She joins us here this morning. Kelly, good morning. Good to see you.
Good to see you, Luke. Thanks for having me today.
Yes, and you brought in a very special guest this morning.
I did. I brought with me Dr. Renu Paneru, and she is our new ENT doctor here at Titusville. She's been with us since October. So, yes, thanks for having her on. We're excited to have her.
Yeah, welcome.
Thanks
for being with us.
Good morning, everyone. Thank you.
Tell us a little bit about yourself.
Yes, so thank you for having me. And I'm really happy to be here and share some information about the ENT practice that me and my team will be providing at Titusville Area Hospital. So to begin with, I'm Dr. Renu Raneru. I recently graduated from Rhinology Fellowship Program at St. Elizabeth Medical Center from Boston University. So I'm here now as the ENT surgeon in the town.
For somebody who might not be familiar with ENT, talk a little bit about that.
So the ENT basically it stands for ear, nose, and throat. So I deal with a lot of disorders that affect your ear, nose, and throat. So basically it's chronic tonsillitis, chronic rhinosinusitis, hearing loss, a lot of ear infections, thyroid disorders. So these all are included in ENTs.
So this would be a busy time of year for you.
It is. It's getting busy and busier.
What are some things that you're seeing now or you've seen over the last couple of months?
Yeah, a lot of chronic sinus cases,
Yes.
a lot of nasal polyps. You know, the people, they are not aware in their early life because nasal breathing is just like your vision and hearing. Until and unless anybody tell you, oh, you're having this, so they cannot, especially kids, they are not able to tell, oh, I'm not having some nasal congestion. So I'm seeing a lot of chronic sinus issues, and I'm seeing a lot of chronic ear infections, especially the kids who are having recurrent ear infections, and a lot of sleep disordered breathing in kids. You know, when they are growing at the age of 5 or 6 years, they have this adenoid hypertrophy, which is a small tonsil at the back of the nose. It is supposed to be small as the kids tends to grow and they outgrow it, but most of the kids, they don't. And that have a lot of effect in their hearing, in their behavior, especially because if they are blocked and they cannot breathe well, they don't get enough oxygen, they produce a lot of adrenaline in their body, and that might lead to hyperactivity issues as well. So I'm seeing those. I'm seeing a lot of thyroid nodules, and many, this is winter, so a lot of nasal bleeding, a lot of epistaxis. So yeah.
A lot of Vicks being used this time of year.
And the allergies. Now the allergies are on the peak, maybe next week or so from the March itself, so we'll be seeing a lot of allergies.
Like my allergies, like 2 times of the year really
Yes.
like flare up in my sinuses, but it's like when the weather changes anymore, like if it were going to go to like 50 degrees tomorrow, like the sinus pressure is just devastating. The other thing is I've noticed too, my hearing got worse when I got married. Is there any medication for that, or I'm just not listening?
Just listen to your wife carefully.
Okay, I just checking it. When people are coming into your office, are they? I assume they're looking for instant relief or something. Are there short-term solutions, long-term solutions? And I would imagine everybody's a different case.
Yeah, everybody is different. Every patient is different, and it also depends on the severity of disease, what they are having. So also the duration of the disease. If it's acute issues, you know, it's just happened for the first time. Suppose ear infection, it happened for the first time. We can treat it medically. But if it's going every year recurrent, it's going like a lot of infections going on. So first we have to find out what's the cause. What is giving you ear infection? Because in kids, it could be adenoid hypertrophy, it could be chronic, sinus issues, chronic Eustachian tube dysfunction. So this term is a little fascinating. So the Eustachian tube is a muscular tube which connects your ear and nose. Everything is connected. Ear, nose, and throats, they are connected. So if you have issues with the Eustachian tube, you will keep having, blockage, hearing loss, ear ache, ear problems. So yeah, so basically if it's acute, I treat it medically, and if it's getting they're getting a lot of infection, it's going for a lot of time, then I go with the screening. So basically, if they need imaging, any CAT scan, any X-ray, any endoscopy that they need, so we'll do it accordingly.
Are you finding that your office is getting sort of inundated with calls right now, or are there some things that folks can do at home to kind of help? I kind of joked a little bit about rubbing some Vicks, but that seems to help some people. Are there things that you can do at home or no?
No, basically no. There are few conservative methods, like if you're having jaw pain, TMZ pain, then you can apply heat, you can take any analgesics like Tylenol, ibuprofen, but you should seek a medical advice, just like any allergy pills, what allergy pills you should take, and the sprays, which sprays you should be doing, the Afrin, especially the Afrin, it's a nasal decongestant, which is over the counter. So people, whenever they're nasally blocked, they just keep using it. So if you use it for more than a week, there's always a tendency for rebound congestion. So you get into it, you get trapped into it. So you should seek medical advice before doing anything.
So call the office and schedule an appointment.
Yes,
okay.
That's the thing.
What age did you know this was the direction you wanted to go? You wanted to get into healthcare?
In my early life, I was more, into medical field. I used to think doctors as magicians. Whenever I used to go to doctor's office as a kid, they used to treat me, and I was like, how did that happen? So I always decided, in my mind, I was always sure that I want to be a doctor. So during the med school, as I was exploring a lot of specialties, ENT drew my attention because, the ENT problem, one member in every family in a community is affected by ENT problem. And it affects your quality of life drastically.
Yeah.
So when you treat them, there's a significant improvement in the quality of life, day-to-day lives. Whether you say it's vertigo, whether you say ear pain, the chronic sore throat, the chronic rhinitis, if you treat it, and the nasal obstruction, who are not able to breathe, especially with the deviated septum, polyps, and once you treat them medically or surgically, they will say, oh, it changed my life. So that was very rewarding to me. And during my training, I saw my ENT surgeon doing all the surgeries, and the changes that you can see before and after surgery was completely fascinating and amazing. So yeah, and I decided to be an ENT surgeon, and I am now here, just ready to serve the community.
That's great. I just saw a news package a couple months ago that said seasonal allergies across the board are just up across.
It is.
Okay, so there's a lot of people I've run into even this past year who've said, I've never suffered before, but I'm
the
suffering.
counts, the pollen counts, and
Yes.
everything, they are increasing. Yeah.
Yeah. Was there ever a backup career if or was it always
Always,
health? Okay.
I was always headstrong that I want to be a doctor.
Well, that's fantastic. That's great. Well, welcome to the community, and
Thank you.
congratulations. And we'll come back and talk more about it in a moment. But Kelly, there's so much happening at the hospital. Give us a rundown of what's going on and what's coming up.
Yeah, there's so much happening at the hospital. We have golf coming up. That
What?
is going to be, yeah. By the time it comes, you're going to be so sick of hearing about it. But so golf is happening May 21st. Get your teams in. I actually already have 2 teams. You can go online and register on the TAH website. We are accepting donations. We are accepting sponsorships. All the information is online. We are consistently updating it as information is coming in for sponsorships. So
3 months.
3 months away. Yeah.
Do you feel like you're ready?
We're getting there. Yeah, the amount of work that we've already put into this is amazing. I already have donations. We have some really great prizes already that were donated. We really start working on this in January. That's
great. And the money raised, I know you. There's always a project you're working on.
Yeah. So this project is pretty neat. It's not happening within the hospital. It's happening in one of our outpatient offices. So the outpatient office for physical therapy is getting an expansion. So what we're going to do is expand therapy services there, and it will house not only physical therapy but also speech therapy and occupational therapy. Since we're expanding that office, we are able to also add a pediatric sensory room, which is going to be the first in this service area. So definitely a need in the community for those kiddos that are going to benefit from that sensory room. We're also adding a OT simulation room, which is, if you're having problems doing some things at home, like daily activities, cooking, things like that, they're going to actually have an area set up that you can go through those processes with the OT right in the facility. So
Wow.
just some new things, and that's what golf is going towards this year. So pretty exciting new
That's
project.
fantastic. When you look at over the years, just sort of the expansion, opening up, offices and other locations to kind of help serve. I know we're in a rural area, but even more rural areas. I know the response has been phenomenal.
Oh yes, yes. We get so many so much support for the community. When we start working on these projects, letters go out, things like golf and different fundraisers that we do. The community definitely steps up, supports these projects, and they're a big component of how we get all of these different projects done and keep upgrading and keep updating all of the services that we can offer.
That's fantastic. Let's do this real quick. You're watching The Morning Drill on Stream TV and on the Armstrong Neighborhood Channel. Our friends from Titusville Area Hospital with us here this morning. Well, Kelly, in terms of that kind of growth, is this something that is discussed at board meetings? Are you trying to see where the needs are? Are you having the communities reach out to you? Are doctors and physicians and staff members coming to you presenting ideas like, hey, I'm hearing this? How does that work in terms of where what areas you want to expand to?
Yeah, absolutely. All of our doctors that we have are definitely have the greatest touch with the community and what the needs are. If they are recommending these OT services or specific services that we don't have, and they're sending these patients out to Erie or further sometimes, that's definitely brought up. Like I'm sending a lot of kiddos and families or adults to outside of our service area. Do you think we could bring that home and keep everyone here? Traveling is always a concern. Kids missing school, things like that, especially roads, this winter have been not great. Traveling to Erie has been really hard for a lot of patients that require those services that we don't have.
Yeah, and Doc, I'm sure when you're already experiencing a pretty busy office and somebody has to cancel and trying to get them back in, to schedule them to come in, that can be challenging.
It is. So right now, again, we are already booked till March. So somebody, if they cancel, they have to wait till April. So they are like, can we squeeze in? So yeah, it's definitely a challenge.
Wow. All right. Coffee talk.
Yeah, so last week we had Dr. Gates. He set up a little session right in our coffee shop at Coffee Days in the hospital lobby. We have another session coming up March 13th and also May 8th. He is really just talking about some joint pain, what your options are. He is introducing some new things that, again, are not offered in the service area currently. One of the things that he talked about at the last session was ultrasound guided injections. So basically doing some ultrasound right in the office, which a lot of offices aren't doing. So he talked a lot about that. So if that's something that interests you and you want to hear about it, come on into the coffee shop for the next session. You can go on our Facebook page, or you can give me a call directly and reserve a spot.
Excellent. We just wrapped up Valentine's Day.
Yes.
But it's a good time to be thinking about the heart, right?
Yeah. So February is American Heart Month. So we had Go Red Day for women. This is just the time of year that we really focus on cardiovascular support. We have cardiac rehab that's offered at the hospital. And really it's just for anyone that has had any kind of heart attack, heart failure, other heart conditions. People of all ages can benefit from cardiac rehab. It's a supervised program that just helps improve your overall heart health. They have treadmills set up. For those of you that have been through the program, Angie Russell is the head nurse in that program. She's been doing it for many, many years and is just a giant asset to the hospital within that department.
Excellent. Anything else happening with the hospital? Always something going on.
There is so much going on all the time. We actually had Dr. Weathley. She was an ER doctor for 33 years at Titusville. So if you have, been in the community and visit the ER, Dr. Weathley has probably seen you or your children at some point. So congratulations to her on her retirement after 33 years of service at the
Wow.
hospital. So
That's great.
yeah.
Okay. Always celebrating, welcoming, growing.
Yes, always offering new things. And like we were talking about golf, that's a really great way for the community to get involved and really show their support for the hospital and the things that we do. It's our main fundraiser for the foundation. Last year we raised $38,000. Of course, my goal is to increase that every year. It's a pretty big goal. For a one-day event, $38,000 is a lot to raise.
Just a few bucks.
Yeah.
See, Doc, don't be surprised by that, because when you have people like me golfing, she knows I'm not going to win anything. So all that can stay with the hospital.
Yeah, we
so.
keep all of his money.
Yes, it's fine. It's a fun day. It's a great time. When you came to Titusville, what impressed you the most?
So, the Titusville area hospital, when I researched about it, it's an independent community hospital. It's thriving, and the lot of work, the work that it is doing to deliver, high quality, patient-centered care to the community, that really had deep impact on me. And I feel like there's a very dire need of ENT service in the community. They have to travel. If I'm not here, if I'm not providing the service, they have to travel either to Erie or Midville or Pittsburgh. So I feel like my skill and experience in otolaryngology can make a meaningful impact here in the community. So that really attracted me here. And the people here, when I visited for the interview, they were really nice, warm, and welcome. So then I decided, along with my husband, like, oh, this is the place we want to be here, raise the family. So yeah.
That's fantastic. And it goes back to something you said earlier, where, even as a little girl, just looking at your doctor going, I want to do this. I want to make a difference.
Yes.
And you get to do that here.
Yes, definitely.
That's fantastic. What sort of things do you do at the end of the day to relax and, leave work behind? And
I know. I have a daughter who is 4-year-old, so my hands are pretty full with this full-time position, So whenever I get time, I'm a trained dancer, so I love dancing.
Oh, excellent.
And I have a passion with the cooking. I love cooking food and serving to people who I love. And then, again, in the free time, whenever I have time, I love going outside and exploring new places. So definitely waiting for summer to go out and enjoy the places. So yeah.
All right, we'll get you skiing, and it'll be great.
In the meantime.
Yeah, that's right. But no, there's lots to explore. And again, if somebody is suffering through anything related to ear, nose, and throat, you don't have to go through that. You can make an appointment and start to have this conversation and try to figure out what's going on.
Yeah.
What are some common things that, if you're experiencing what, they should make a phone call to your office?
Okay, so the first thing is that, especially in kids, if you see the kids are snoring very loud at night, they are breathing through their mouth, their breathing is stopping at the middle of the night and frequently waking up, and you see their teeth, they are overcrowding, there is a bite problem, and they don't tend to eat, especially because if they are mouth breathing and if they start eating, their mouth is closed, so they don't want to eat, but that they cannot complain. So if you are seeing these issues in your kids, please bring them in the office. We can screen them and evaluate. And other thing is hearing loss. If you're having any issues with your hearing, we're always there. And the good news is we will be starting our own hearing center for hearing tests soon.
Oh, wow.
Yeah, and then you don't have to wait for weeks and months to go to other places and get hearing tested. And if you have allergy issues, we have started the skin allergy clinic, which started from the February, and we're doing really well. We already booked till March. So if you have chronic allergy issues, like you have postnasal drip, rhinorrhea, that is not being controlled with the medical sprays that you have tried for over the years, so then definitely you should come and make a visit with us. Other problem is, like, if you have lot of allergies, asthma, and you cannot breathe well, you have chronic sinus infection, like you're getting infection more than 3-4 times in a year, you're taking lot of pills like candies and it's not working, you should definitely get checked out. You should definitely get an imaging to see what's going on with your sinuses. Most of the time there could be polyps that needs to be taken care of.
Okay. do they call your office directly? Do they work through their primary care physician to get to you? How does that work?
Again, it depends on their insurance, but they can always call the office and make an appointment. Yeah.
We appreciate you coming in. We thank you for everything that
you
you're
for having
doing.
me.
And yeah, it's exciting. We'll have to have you back.
Sure, definitely.
Great. And then Kelly, with everything that's coming up, kind of run down quickly those events coming up to keep
Yes.
in mind. And
Yes, so keep in mind, golf is coming up May 21st. If you want to be a sponsor or do anything donation related, you can call the foundation office directly, which is actually me. So 827-1060. Dr. Gates has his coffee talk coming up. You can also call to schedule or reserve a seat for that. Or if you don't have time, you just want to stop in, we would definitely welcome you. That's coming up on March 13th. And if you want to call the ENT office, Dr. Paneru, you can also call her at 827-9770 and schedule an appointment.
that's excellent. I think we're running out of time, so we won't have time to do that live demonstration that you were going to do on Kelly. We'll have to save that for next time.
Next time.
So, yeah.
Next time, always the next time.
Always the next time. And then, Kelly, even with these great events, if you're somebody that is looking to support projects, you don't have to wait for certain times of the year. You can always reach out to the hospital. And
Yes, you can always reach out to the hospital. We accept donations all year round. If you would like your donation to go to something very specific, like you were in the oncology department and you thought that you had a fantastic job, you can make your donation go directly to that department. All of those monies help support new equipment, things like that. So, yes, we are always, collecting money for the foundation. And thank
Just
you.
give the hospital a call.
Yes.
And the foundation. All right. Thanks for coming in this
Thank
morning.
you.
All right.
Thank
all the
you.
best.
Thanks for watching this clip of the morning drill. Just give it our YouTube channel to discover more.